Hello, everybody. Good evening. This is Dr. Rashi, and on behalf of the Homeopathic Academy, I am welcoming all of you to this live webinar. Today is 5th of August, and we are right in the middle of the breastfeeding week. I hope everybody knows that World Breastfeeding Week runs from 1st of August to 7th of August, and we are right in the middle. And you know what could be a better time to talk about women and their reproductive health? So that's what today's topic is. We'll be talking about women and their reproductive health. We'll be talking about the diseases that women fall prey to during this phase of life. We will talk about the management of such kinds of diseases. And in general, we'll be talking about, the health, everything about reproductive phase of life. To talk about all this, we have with us Dr. Deepthi Anand. Ma'am, please join in. Hello, ma'am. So let me introduce all of you to Dr. Deepthi Anand. Dr. Deepthi Anand is assistant professor with Veerbhadra Homeopathic Medical College in Karnataka. And she will guide us on reproductive phase of a woman's life and the diseases we fall prey to therein. Now, before we begin with the discussion with ma'am, let me also introduce you to the Homeopathic Academy. I'll just brief you on what is Homeopathic Academy and what do we do and what are we doing here today. Just very quickly, I'll take just a minute from ma'am's time. So the Homeopathic Academy is a unit of B Jain RX. All of you are homeopaths, and none of us need an introduction, a formal introduction to the B Jain Group. Everybody knows what is B Jain. The Homeopathic Academy is the brainchild of the B Jain Group. We produce online homeopathic courses, and this is just an attempt by B Jain to take homeopathic education forward. And of course, by leaps and bounds, because this takes you to the digital arena. We offer courses which have state-of-the-art video technology. We have courses of all levels. We have courses of undergraduate level. We have courses of postgraduate level. We have CME courses, and we also have courses that prepare you for competitive exams. You have this PPT on your screens. In the right-hand side panel, you can see the PPT, and you can also download for your reference. We have all these courses here, or you can log on to www.thehomeopathicacademy.com and go through our courses and log into whatever course that interests you. Okay, thank you, everybody. So, ma'am, can we begin with the discussion?
Of course. Hello, everybody. Hope all of you are doing good. Today, we'll start with the reproductive milestones in women. Hope all of you are doctors here, homeopathic doctors. And as you all know, the reproductive milestones include puberty, menopause, menstruation, pregnancy, and parturition. See, once a girl is born, she is born with a lot of follicles in her ovaries, and each one of them, they start maturing once she attains puberty. Puberty is a age which starts at around 8 years of age, and it is the first period marks the onset of the menstruation or the reproductive age of a woman. That is starting of the first menstruation in a girl. That may be the normal is at around 11 to 14 years. So that begins the reproductive age. Why is this so important? Because puberty gives the power to reproduce. Puberty is the beginning of reproductive age, which means from there a woman can give birth to a child. That also means she can start a new life within herself. That is, as see, even human beings are animals, and as other animals, the basics of living is nutrition, living, and also continuation of our species. So puberty in girls is very important because to continue species, to reproduce, onset of puberty is very much essential. You all know this. So next is menopause. Menopause is the stop of menses or stoppage of cessation of menses at the end of reproductive period in a woman. So a woman can give birth to a child only between puberty and menopause, and between these two there is occurrence of menstruation, menstrual cycles on a periodic intervals regularly. So we'll discuss in this course, we'll discuss the first 3 milestones, that is the puberty, menopause, and menstruation. Pregnancy and parturition altogether is a very big course, in fact, and it requires a lot of time and cannot be discussed here. So first of all, to know all these, we need to know the anatomy, functional anatomy of the female reproductive system. Without knowing any anatomy or normal structures, it is difficult to understand what is happening abnormally. So the female reproductive system is made up of external genitalia, internal genitalia, and breasts. Breasts are the accessory organs of reproduction. As Dr. Rashi said, we are in the middle of breastfeeding week. So breasts play a major role in the nutrition of the young, that is the newborn child, at least till the age of 6 months. And later it is a supplement till the age of almost 2 years. So breastfeeding is very much important. It is essential both for the mother and the child because it has its own benefits, which we'll be discussing later. So external genitalia include mons pubis, labia majora, labia minora, vestibule, and the clitoris. So as you all know, the picture is self-explanatory, and the mons pubis is a pad of connective tissue which is present just above the pubic bone. And next is the labia majora, which are the folds of skin on either side of the vulva. They are outside. The labia minora are again folds of skin which are inside. They cover the vaginal orifice. Next is the clitoris. Clitoris is homologous to the penis in men and it is an erectile body. Next is the vestibule. It is a triangular area which is composed of clitoris at the top and the vaginal orifice behind. So this is about the external genitalia of the female reproductive system. Next, when we move on to internal genitalia, it includes vagina, uterus, fallopian tubes, and the ovaries. Again, when you see in the image, you can see the uterus is a hollow muscular organ. Uterus is the hollow muscular organ which is made up of perimetrium, myometrium, and the endometrium. And the ovaries are the paired organs which are also called gonads, and here is the place where follicles proliferate and mature and ovulate into the fallopian tube, which is the place where the fertilization occurs. You can also see the lower part of the uterus is called cervix, and the lowest part is the vagina. Cervix ends in the vagina inferiorly. Cervix is made up of two openings. One is the internal os, the other is the external os. This is about the internal genitalia of the female reproductive system. Next, we'll also discuss the functional anatomy of the breasts. Breast is a fat tissue. It is also made up of acini, which when required produce milk and nourish the newborn child. Otherwise, breast acts as accessory organs and they are there for the nutrition of the newborn. Next, we'll discuss what is puberty. As you all know, puberty, as I told you, is the beginning of the reproductive age of the woman. In this course, we'll be discussing normal puberty, its disorders, and also the homeopathic therapeutics of these pubertal disorders. Normal puberty includes at what age it occurs, what are the hormones which play a role in puberty, because puberty is a process and it doesn't occur overnight. The changes start at around 8 to 9 years in a girl's body, and it continues till she attains the first menstruation, that is the first period. That is the mark of puberty in girls. In boys, it is indistinct and it occurs between the age of 9 years to 14-15 years. Okay, so in puberty, there is development of secondary sexual characters and also the growth and development of the external and internal genitalia. All the hormones play a major role. Hormones like follicle stimulating hormone, luteinizing hormone, the estrogen, progesterone, all these hormones play a major role in the occurrence of the puberty normally. The disorders can be named as precocious puberty and delayed puberty. Precocious puberty is a very common problem in the girls of these days. Precocity is when a girl attends her first period before the age of 10 years. And it is very common and there are many causes for it. It can be complete complete puberty, which is precocious, that is development of sexual characters and also the growth and development of internal external genitalia before the age of 10, or there may be individual parts of the individual phases which can happen separately before the age of 10 years. Delayed puberty means when the girl does not start menstruating even after 16 years of age. That even here there may be improper development of the sexual characters or the genitalia, or even when there is development of all these, there may be delay because of some imperforate hymen or some other hormonal problems. So all these are discussed in detail in this course, and we have also discussed the homeopathic therapeutics so that it helps the students and also the clinicians who have started their practice just now, and it helps them to distinguish the remedies, because delayed puberty can have each, if for example, if there are 10 girls with delayed puberty, all 10 cannot be given the same remedy. So distinguishing between the remedies, differentiating the remedies, and arriving at the simillimum is a challenging task. So the remedies are differentiated in the homeopathic therapeutics. Next, we'll see what is menopause. Menopause, as I told you, is the end of the reproductive life in a woman. So menopause normally should not cause any trouble. There are very mild symptoms and which can be dealt easily at home. But if there are symptoms, there are disorders, like there may be disorders due to menopause and disorders of menopause. Disorders due to menopause may include the the bones become more porous, because estrogen helps in maintaining the bone density. So once after menopause, when there is low estrogen, the bones become more porous, and the woman after menopause is easily she can get fractured easily in the weight bearing bones. And the other disorders which are due to menopause as a consequence or as a result of menopause may be atherosclerosis. So the ratio of occurrence of stroke and cardiac problems in men becomes equal with women after menopause in women. Once the woman attains menopause, the incidence of cardiac problems and the stroke or the cerebrovascular accidents become equal, because the estrogen has a protective effect on the arteries and veins, on the blood vessels. That is, it maintains or it regulates the flow of blood, and also it has a very protective effect. It does not allow the hardening of the arteries and veins. And in a woman who is menstruating, the occurrence of cardiac problems or problems in the vessels is very, very, very rare. It is less than 1%. That too, if it occurs, that should be congenital. So that is the disorders that was caused as a consequence to menopause. The disorders which are in menopause are delayed menopause or precocious menopause. If a woman attains menopause before the age of 40 years, that is called precocious menopause, or premature menopause. If the menopause does not occur even after the age of 55 years, then it is called delayed menopause. As puberty is a continuous process, menopause is also a process. It can never happen overnight. So the the body starts changes at around the age of 48 or 45 or 48 years, and it continues, and the menses or the menstrual cycles can stop without any problems. But in some of the women, women may undergo problems like menorrhagia, metrorrhagia, leukorrhea, or other disorders. There is a set of there's a set of psychosomatic symptoms like hot flushes, mood swings, and all these, getting irritated easily, all these. If they are mild and if they can be managed easily, that is normal. But if it becomes severe, it requires treatment. And delayed and precocious also require treatment. And we are discussing homeopathic therapeutics here also. And again, here also, we are differentiating the remedies, which helps the prescriber and also the students. Next, we'll be discussing the menstruation and the phases of menstrual cycles. See, as you all know, I told you the woman has her reproductive period between puberty and menopause. So, when we know in between this there is menstrual cycles, and these menstrual cycles occur periodically. It has to be, the duration of each cycle has to be 28 or 25 to 35 days, and the flow duration has to be for 3 to 5 days. This is normal menstruation, and there are some of the symptoms. Normal menstruation is bleeding per vagina every month, because every month uterus prepares itself for an expected pregnancy. Okay, uterus prepares itself for an expected pregnancy, and if the pregnancy happens, there is no menstruation for the next 9 months or even during lactation, after childbirth and during lactation. But if there is no pregnancy which occurs, then the uterus weeps in the form of bleeding, and the endometrium is shed, because ovulation occurs once a month. That is, one egg is released once a month, and that is viable for 48 to 72 hours in the female fallopian tube. So if pregnancy occurs, that is entirely a different issue. If there is no pregnancy, there should be occurrence of menstrual cycles, and regular occurrence of menstrual cycles is very important for a woman to be healthy, because it determines the health of a woman, and irregular cycles can lead to many problems. Irregular cycles can lead to weight gain, irregular cycles can lead to polycystic ovaries, irregular cycles can lead to infertility. So cycles give the power to the woman to reproduce, that is, create a new life. Menstrual cycles are very important, and ovulation is very important to create new life. And we also discuss the phases of menstrual cycle, which include phase of regeneration, phase of proliferation, phase of secretion, and phase of menstruation. Phase of regeneration occurs just after the menstrual cycle. Just after the menstrual cycle, that is just after bleeding, there is phase of regeneration. Next is the phase of proliferation, where the follicles are selected. 3 or 4 follicles are selected, and only one of them will mature to get ovulated and go into the fallopian tube and wait for the sperms to get fertilized. Next is the phase of secretion, where there is preparation of the endometrium. If there is fertilization of the ovum, there is preparation of the endometrium for the fertilized ovum to get embedded. That is, endometrium has to become like a cushion. It has to implant the fertilized ovum, right? It has to implant the fertilized ovum. That is where there is endometrium thickness is increased, and also the corpus luteum in the ovary, it secretes a lot of progesterone to support the pregnancy, if at all, if it happens. If so, all these phases, the last phase is the phase of menstruation, where when there is no pregnancy occurring, the endometrial layer sheds, it starts bleeding. So all these phases have their own effect, that is the hormones. All these phases are controlled by the hormones, and they have their own effect on the uterine endometrium and also on the ovaries. So there are 2 cycles occurring in one menstrual cycle. One is the ovarian cycle, the other is the endometrial cycle. So last, we discuss about the problems of the menstrual cycles, that is dysmenorrhea, menorrhagia, metrorrhagia, and also the homeopathic therapeutics of each condition. Dysmenorrhea is painful menstruation. Menorrhagia is increased menstruation, either quantity or duration. Metrorrhagia is intermittent bleeding, that is, in between the cycles when there is no necessity for bleeding. If bleeding occurs, that is metrorrhagia. So we will discuss the homeopathic therapeutics, we will discuss the condition and also the homeopathic therapeutics of each condition. Again, differentiating the remedies is a highlight. So, finally, it is the most important topic that we'll be discussing is the hypothalamo-pituitary ovarian axis. It is a master. The hormones are the masters. That the hormonal endocrinal system is the master, and all these milestones are puppets in the hands of the hormones. Hormones are correct, milestones are correct. Hormones are not correct, milestones are irregular, or milestones there is a variation. So hormones are required in very little quantity, but they do a very great role. They play a very great role in everything, even in pregnancy and parturition. So hypothalamus secretes a few hormones which are the gonadotropic releasing hormone, and also the thyrotropic releasing hormone and growth hormone, all growth hormone releasing hormone. In fact, whole endocrinal system works along with the nervous system to control everything in the body. See, we cannot say that only estrogen and progesterone are important for the milestones to occur, or only follicle stimulating hormone, luteinizing hormone. No. Actually, even the thyroid hormones, adrenocortical hormones, and the growth hormone, all the hormones are essential. Hormones are interconnected. They cannot be separated. But follicle stimulating hormone, luteinizing hormone, estrogens and progesterone play a major role. But the thyroid hormones, the adrenocortical hormones, and growth hormone also play in the background. They help for it. Okay, so hormones are like controlling units. So they control the milestones, and they all that is what is the function of hormones. So this was about the course which I'm going to discuss. Here I want to add a few points about the therapeutics. That is, we have discussed the therapeutics of pubertal disorders, menopausal disorders, dysmenorrhea, menorrhagia, and metrorrhagia. In the course, we have discussed about 10 remedies for each condition, but there is no restriction that for that condition only those 10 remedies are prescribed. The main idea of discussing different remedies for each condition is I will be able to cover around 50 remedies, and any remedy can be prescribed for any condition when the symptoms match. Okay, the main idea is to discuss 50 remedies and differentiate them so that it would be easy to learn, it would be easy to understand the homeopathic therapeutics in a right way. The rubrics are also considered. The rubrics of each condition is also considered, so that the users or the learners will be helped to use the repertory also, because homeopathy stands on a tripod, as we know: organon, materia medica, and repertory. And once we in organon is a manual to know the rules of prescription. Repertory is to search the remedies. So using a repertory is also very important. And once we have selected a remedy, after that we have to cross check with the materia medica so that the remedy similarities match. Then only we can prescribe. So here I end my small talk, and over you, Dr. Rashi. Thank you so much.
Thank you so much, ma'am. That was really illuminating. Thank you so much. So I think we are open to the question answer session. So all of you who have questions for ma'am, we'll be taking up questions one by one. And you can type in your questions onto the chat box and mark them as questions. Meanwhile, I have some news for all of you. So the Homeopathic Academy is running live with 35% off on all its courses. Again, if you go onto the offer section, you will know you can use the coupon code THA35 and you can log on to www.thehomeopathicacademy.com and purchase whatever course you like from our website and use this code to avail the discount. Okay, I think let's take up the questions. Ma'am, could you please switch on your video and microphone?
Yeah.
Ma'am, so the first question that we have is from a learner. Why does a woman develop osteoporosis after menopause?
Yeah, see, as I told you, the estrogen has a regulating effect on the bone calcium. Estrogen, along with the parathyroid hormones, regulates, and also thyrocalcitonin, regulates the bone calcium. It prevents the mobility of the calcium from bones to the blood. That way, it has a protective effect on the bones. And once after menopause, the estrogen decreases because ovaries atrophy, uterus atrophies, everything atrophies. So once the ovaries atrophy, the estrogen levels decrease and the porosity of the bones increase. So that way, postmenopausal women face a problem of early easy fractures and also the, as we say, the knee pain, arthritis, and all the skeletal, the bone disorders and joint disorders. Hope I cleared the doubt.
Thank you, ma'am. Dr. Jagriti, she wants to know that therapeutics part has not been taken. So she wants to, maybe you could talk about the therapeutics section a bit. The homeopathic therapeutics for the various disorders that we fall prey to in reproductive phase.
Okay. See, the detailed therapeutics are, described in the course. You please enroll to the course, Dr. Jagruti, and you'll know the details of the therapeutics. But if you just want to know, there are so many remedies. As I told you, I've discussed around 50 remedies in the course. Like maybe Naxwamika, Pulsatilla, Lachesis, Phosphorus, some of the bleeding remedies like Hamamelis, Retania, Fraxinus, etc. So to know each and every detail, it's better you enroll to the course. You will definitely be benefited and you'll know the differentiation easily. Hope I cleared it.
Ma'am, I think the homeopathic materia medica is so vast, covering everything in a single webinar is not possible.
Correct.
So
Exactly.
yes, you can actually log on to the website and go to ma'am's course. Ma'am has dealt with everything in a little, in a lot of detail. Everything has been covered there.
Yes.
Okay, ma'am. The next question that we have is, what is the reason behind a woman developing menopausal syndrome?
Again, the answer is the hormones. See, basically, as I've told you, the most of the female problems are related to stress also. Around 30% effect, the stress has around 30% of the effect. And premenopausal syndrome, I think you've asked about premenopausal syndrome. Premenopausal syndrome, that is what I told you. It has symptoms like hot flushes, mood swings. It is same like puberty. Even during puberty, teenage, the girls have all these problems. They have mood swings, all these things. Same way, the premenopausal women also have the problems like hot flushes. And there is also stress playing a role. Again, hormones play a major role, because see, almost for a span of 30 years plus, 35 years plus, her body was undergoing periodic regular changes of menstruation, right? Every month there is reception of hormones, every month there are changes. And once the body starts in setting about menopause, again there are changes, there is stress, even emotional stress, or like there may be stress like family stress may include settling down kids, or there may be many things are there, right, at that age, around 45 plus of age. So all those things will count. Hormones, stress, everything will count and will lead to premenopausal syndrome. So there are beautiful remedies in homeopathy to treat all these disorders. Okay, hope I cleared the doubt.
Thank you, ma'am. We have another question, again pertaining to endocrinology. So this question is, what is the reason behind a woman developing insulin resistance in PCOS?
Very good question, actually. See, PCOS, as I told you, PCOS or PCOD. PCOD means basically is polycystic ovaries. What happens in polycystic ovaries is there is a lot of estrogen. Again, hormones are not working properly. That is vicious cycle again. The hormones are not working properly because of the sedentary lifestyle. Continued long sedentary lifestyle, again hormones are not working properly. So that is a vicious cycle. So because as I told you, every month there are 3 to 4 follicles which are selected, and only one undergo maturation and ovulation. But what happens in PCOD, and for ovulation to occur, there is a requirement of progesterone. Okay, what happens in PCOD is there is a lot of estrogen and progesterone is less. That is, the cycle gets delayed. So there are so many follicles which are proliferating, but none of it is maturing. So there is polycystic, and these follicles which have only developed and have not matured start collecting the fluid, and it becomes cyst. This is what is the main idea of polycystic ovaries. Okay, and once there is no regular cycles, that leads to weight gain. Weight gain, there is increased surface area. Once there is increased surface area, there is again taxing of the pancreas. Insulin is affected. Pancreas is affected because it has to produce more insulin. And estrogen also causes the cells to become insulin resistant at one point when there is very high estrogen at one point. So that also causes insulin resistance. And again, it is a cycle. PCOD, diabetes, PCOD, lifestyle disorders. So women who are at a verge or who are already suffering from PCOD, it's an alarm. They have to do some physical activity. Physical activity increases insulin sensitivity, and thereby estrogen, again it has a effect on the estrogen. Estrogen reduces again, and that is, it reduces to normal. And then again the follicles, developing follicles, they under the influence of progesterone, they regress, and the normal follicles again they start developing and they mature and they ovulate. That is what is important. Hope I cleared this doubt.
Thank you, ma'am. Ma'am, endocrinology is actually very vast. It's very difficult to understand hormones. So I guess that's why, most of the people have confusions there. So for all the students who have doubts in endocrinology, we also have a course on ailments of the endocrine system where we've covered everything. All possible diseases have been covered, which even remotely are related to the endocrine system. You can go on to the website and watch the promo there. Okay, so the next question, ma'am, this is regarding diet. It has been claimed that a diet change improves PCOS. How does this happen?
See, in this era, I think most of us are eating a lot of junk. improving diet, of course, if you are eating healthy diet, maintaining healthy diet, of course there are changes. It is the ovaries respond. As I told you, hormones are required in a very less quantity, and healthy diet and proper exercise does 60% of work in PCOD. Okay, of course diet helps. Diet helps a lot. Healthy balanced diet, which requires what is made up of healthy balanced diet, is made up of 70% of carbohydrates, 20 to 25% of proteins, and 2 to 3% of fat, and rest other minerals, vitamins, everything, and also adequate amount of water. So this is a balanced diet. And to tell you one thing, all Indian food, you be of whichever region, let it be of whichever region, is balanced. To tell you, and Indian food is time tested. That is why it has stood the what do you say, for ages, almost for more than 1000 2000 years. Indian food is the most scientific food. And following, if you want to follow balanced diet, have home food, homemade food, Indian food. That is the best thing I can suggest. Thank you.
Ma'am, also I think because there is role of insulin and glucagon there, so maybe low glycemic index foods and foods low on carbs, they obviously improve the health of the ovaries and everything.
No. Just to clear this one, Dr. Rashi. Actually, as we say, low carbs. I just want to clarify a small point here. Like we go behind fat diets. That is, we want to lose weight early, or we want to lose weight instantly. All those can lead to PCOD. I tell you, because for proteins to be digested and absorbed properly, carbohydrates are required. You got my point? So Indian diet, that's what I'm telling you. To increase the glycemic index of carbohydrates, there is a lot of things. Just for example, to tell you, dal, chawal and ghee is a very complete diet, because you are increasing the glycemic index of chawal, rice, okay, by adding lentils to it, and also fat which is ghee. Okay, and if you are adding a homemade pickle, that becomes a probiotic, and that is a very good diet. Okay, so that is what, as again I come to square one. Indian food is the most balanced and most scientific food which you can find anywhere. Thank you.
Thank you, ma'am. The next question, this pertains to homeopathy. Is it true that homeopathy should not be given to lactating women because that affects the child?
No. Homeopathy medicines can be used during pregnancy, during parturition, that is after childbirth, during lactation. There is no such, they are safe, and the side effects are minimal when prescribed correctly. Okay, it's my personal experience. I have given it to pregnant women, I have given it to lactating mothers, and I have also given it to newborn infants. So when you can give it to newborn infants, it is really safe.
In fact, ma'am, Dr. Hanneman has also advised giving with mother's milk, giving medicines with mother's milk.
Yes, exactly.
So in the Organon, that has been given already.
Yes, correct.
Ma'am, another question is, can homeopathy cause abortion?
No. See, homeopathic system of medicine, or homeopathy medicines, are natural medicines. They are very close to nature. They cannot cause the delay of menses. They cannot cause abortion. They cannot cause I mean to say delay of menses. Like, for example, if you want to postpone your menses, that cannot be done with homeopathic medicines, and it cannot cause abortion.
Ma'am, in that case, what about regulating a woman's cycle? Say maybe from 15 to 21 days, or even to 30 days. That is usually done with homeopathy. Then how do we say that we cannot increase or prepone them? periods?
No,
That's
no,
the
no, no.
question.
I was like, see, I was talking about women who are having regular menses. See, there are some, what do you say, some circumstances where you have to postpone your menses. Like, for example, you have regular cycles, but just for this month, you want to postpone menses. That can be done with other conservative medicines, but not with homeopathic medicines. Because in my practice, I have, what do you say, face these questions. Patients ask me, see, this month I just need to postpone my menses, can you give me some medicines? No, that cannot be done. But regularizing irregular cycles are different. That is pathology, that is a disease. This is regular already, this is normal. You cannot make something normal abnormal with homeopathy, but if it is abnormal, you can make it normal with homeopathy. Hope I cleared it.
Thank you, ma'am. Another question is from Dr. Preeti. Can pulsatilla be given safely during pregnancy then?
Yes, if it is indicated. Of course, if it is indicated, if he has any problems, it can be.
The next question is by Dr. A. Mohammed. Can you explain some specific homeopathy medicines for amenorrhea? So I think primary amenorrhea, secondary amenorrhea, I think you will have to go about that way.
Again, see, amenorrhea is again a big topic. There are so many causes for amenorrhea. There are some of the causes like physiological amenorrhea is before puberty, after menopause, during pregnancy and lactation sometimes. But amenorrhea again has so many causes. Like again in PCOD there is amenorrhea. Thyroid disorders, there is amenorrhea. And again, it is very vast. There are so many remedies. If there is symptom similarity, we can give any homeopathic remedy for amenorrhea. Some of the remedies again can be pulsatilla, Nux moscata, Nux vomica, phosphorus, lacases, nitric acid. You can give any remedy, but you should be knowing the differentiating points. And again, all the remedies are discussed in the course in detail. Hope I answered it.
Thank you, ma'am. Another question is, what are the causes of endometritis and what is the treatment protocol?
Okay. Again, endometritis, the causes may be infection or IUCD, that is intrauterine contraceptive device, like what do you say, this Puberty, or there may be the UTI, the urinary tract infection. If it is severe, can lead to cervicitis and endometritis, vaginitis and endometritis. And there may be other bacterial infections. Sometimes there may be tuberculosis and sexually transmitted disease, multiple partners. All these are the causes for endometritis. Again, there are remedies for endometritis, inflammatory remedies. There can be anything to belladonna, to hyoscyamus, to stramonium, to Nux vomica. Anything can be given when there is symptom similarity. Hope I answered it.
Thank you, ma'am. Another question is, can homeopathy deliberately cause an MTP?
No. That is what I answered earlier, right? It cannot. No, it cannot.
Thank you, ma'am. Any other questions? If you have other questions, you can type it in the chat box and mark them as questions. So we'll take them up here. Although I guess it's already 1 hour and we are running out of time. Okay, we are also live on YouTube and we have some questions from YouTube, but I think ma'am has already answered this question. This is pertaining to hormonal balance during the menstrual cycle, FSH, LH. Ma'am, could you talk about that just a bit?
Okay. See, as I told you, menstruation, first of all, there is gonadotropic releasing hormones from the hypothalamus. They influence the antideprecatory to secrete gonadotropins, which are follicle stimulating hormone and luteinizing hormone. And these two hormones are interrelated again. For follicle stimulating hormone to work properly, luteinizing hormone is required. See, there is no such thing that these hormones are zero in the body. They are always there at some minimal level. They increase and decrease, and their action time is very less. For example, if follicle stimulating hormone is released, it does it work, and it's just over. It comes to its optimal basal level. What it does, as the name is suggesting, the follicle stimulating hormone, it selects the follicles from the ovaries. Okay, and the selection of follicles also depends on the receptors for FSH on the ovarian cells. Okay, see, hormones work in they have to be two criteria for hormones to work. One is proper level of hormone. Second is equal number of receptors on the target organ. So where the ovarian cells which have a lot of receptors for folic FSH will start developing. Okay, but which has the highest receptor and which also has the receptor for luteinizing hormone, which also has a receptor for estrogen progesterone, will ovulate. Okay, and follicle stimulating hormone also stimulates the ovaries to secrete estrogen. And after this is for first 15 days. Next 15 days of the cycle, and there is LH surge during ovulation. During ovulation, all hormones are required. All four: follicle stimulating hormone, luteinizing hormone, estrogen, progesterone. All four are required in optimal quantities for ovulation to occur. And once there is ovulation, of course, follicle stimulating hormone will start reducing, because follicle is already selected and ovulated. So it will reduce. Okay, now it is a time for luteinizing hormone, and follicle stimulating hormone has also sensitized the endometrium and the ovaries for the action of luteinizing hormone. Same way, estrogen sensitizes the uterus and ovaries for the action of progesterone. Okay, so this is how, once progesterone is there, if there is pregnancy, corpus luteum secretes abundant amounts of progesterone, and pregnancy is continued. If there is no pregnancy, till 21 days, there is a surge of progesterone, that is increase of progesterone, luteinizing hormone. And after that, yes, everything will come down. And around 25-26 days, there will be withdrawal bleeding, because there is no progesterone. I mean to say, if I say there is no progesterone, there is no that is required quantity of progesterone to maintain the endometrium. So once it decreases, there is withdrawal bleeding. Okay, this is how hormones play. Hope I cleared it.
Thank you, ma'am. Dr. Mohammed, he wants to know something about tubal block. So could you please talk a bit about tubal block?
Okay.
And maybe the therapeutics or something of that sort.
Okay, see, again, tubal block has its own causes. Tubal block, there may be a stricture due to STD or tuberculosis. There may be a tumor which is pressing on the tube. There may be an ovarian tumor. There are so many causes. Only when we know the cause, we can treat tubal block. If it is functional, a narrowing of the tube is functional, or after knowing the cause, only we can treat it with medicines. Again, there are so many medicines for tubal blocks, which can be studied individually. That is what tubal block, basically cause should be known. That is what is important. Hope I cleared it.
Thank you, ma'am. So it's almost 6, and we should be winding up now. Dr. Jayashree says this was a very informative session. Thank you.
Thank you so much.
And we'll be back with similar webinars, and we'll do them frequently with ma'am and all other authors that we have on Homeopathic Academy. All of you can go and visit www.thehomeopathicacademy.com. And I think we can close this session. Thank you very much, ma'am. Thank you, everybody.
Thank you, everybody who have joined. Thank you all.
Thank you, ma'am.